Hey everyone, and welcome back. Today, we're diving into something pretty amazing, the infant neurological exam. We're going to pull back the curtain and see how doctors piece together this incredible story about a baby's health long before they can say a single word.
So how do they do it? How did doctors read a baby's mind? It sounds like a superpower, doesn't it? How do you figure out what's going on in the brain of someone who can't tell you if something hurts or feels weird? Well, it's less about mind reading and way more like a brilliant detective story, where every tiny movement, every reflex is a crucial clue.
All right, so here's our game plan for cracking this case. First, we'll meet our neurological detective. Then, we'll follow the trail of clues, starting with a general inspection, then zooming in on the head, the upper body, and the lower body. And finally, we'll see how the detective puts it all together to solve the puzzle. Okay, so here's the most important thing to get. Since a baby can't talk, the whole exam is basically a silent conversation. The doctor asks questions using gentle touch and observation, and the baby's body answers through its reactions and reflexes. It's this incredible dialogue that's written entirely in movement. Every good detective starts by just surveying the scene, right? And it's the same thing here. Before a doctor even touches the baby, they just watch. These first impressions, gathered from a distance, can give them a ton of information and really guide the whole rest of the exam. To make sure they don't miss anything, doctors often use a handy checklist. They look at the baby's general appearance and any unusual movements. They check out their body posture. Then they look for cutaneous signs, little marks on the skin that can sometimes hint at deeper issues. They'll note any signs of distress. They'll look at equipment like an IV that gives context. And finally, they check the head shape and size. Each one is a vital piece of the puzzle. And speaking of posture, here's a classic clue. A healthy, full-term baby who's nice and relaxed will often just lie like this, in what's called the frog leg position. See how their hips and knees are bent and symmetrical? That's a fantastic sign of normal, healthy muscle tone when they're just resting. All right, let's zoom in on the command center, the head and face. This is where the detective work gets really specific. We're checking the cranial nerves here. You can think of them as the direct data cables running straight from the brain to the eyes, the mouth, and the face. How well these cables are working tells us a whole lot about the brain itself. So here's a perfect example of that. When a doctor sees if a baby can lock eyes with them or follow a bright object, they're not just playing. They're actually testing the optic and oculomotor nerves. It's such a simple little interaction, but it reveals so much about their vision and the tiny muscles that control their eyes. Or how about something as simple as a smile or a cry? A doctor's looking really closely to see if both sides of the face are moving in the same way. If one side seems to droop a little, that could be a clue about the facial nerve. It just goes to show you, even the most basic baby expressions are packed with neurological information. Now, this one is huge. The ability to suck and swallow is incredibly complex. It's like a perfectly choreographed dance involving multiple cranial nerves. So a good, strong suckle isn't just about feeding. It's a powerful sign that all these critical brain pathways are connected and working together just right. Okay, moving down from the head, we get to the arms and hands. And the investigation here is focused on a really crucial concept, one of the most important pieces of this whole puzzle, muscle tone. So what is muscle tone anyway? It's super easy to confuse it with strength, but they're totally different things. Think of it more like the background tension in a muscle when it's just hanging out, completely at rest. It's this constant, subtle signal from the nervous system that gives our bodies shape and keeps them ready to move. Doctors are basically looking for the Goldilocks zone. Not too much, not too little. If there's too little tone, it's called hypotonia, and the baby might feel a bit floppy. If there's too much tone, that's a spasticity, and the limbs can feel really stiff or rigid. Both of those extremes are really important clues. So when it comes to the upper body, the doctor combines a bunch of clues. They'll look at the baby's posture. Are their little hands always clenched in a fist? They'll gently move the arms to get a feel for the tone. They'll check their power by seeing how tight their grasp is. And yep, they'll even test reflexes by tapping on the tendons. Each little test adds another layer to the story. And the investigation just continues right on down to the lower body. It's not a surprise that the exact same principles apply here. The doctor is looking at posture, tone, power, and reflexes, and they're always comparing the left side to the right side, looking for symmetry.
So for the legs, they're looking at posture again. Are we seeing that nice, relaxed frog leg position? Or are the legs maybe stiff and crossed over in a scissoring position? They'll gently roll the legs to feel the tone, see if the baby can kick out against gravity to test their power, and of course, check those classic knee and ankle reflexes. And the detective work doesn't stop at the limbs. The doctor will also carefully check the baby's trunk and spine. They're looking for symmetry, feeling the muscles of the core, and paying close attention to the skin all along the back. Because sometimes a tiny little dimple or a small patch of hair can actually be an external clue to an issue deeper down with the spine. And now, we get to the final act of our detective story. Look, a single clue almost never solves the whole case. The real skill, the art of it, is taking all these little individual observations, from the head, the arms, the legs, and weaving them all together into one coherent picture. This is how doctors make sense of all that complexity. After the exam, they can basically summarize everything into these key categories. Was the tone normal, low, or high? Was the power what you'd expect, or was it weak? And what about the reflexes? This gives them a really clear profile of the baby's neurological status. And this is the moment it all comes together. Pattern recognition. It's the combination of all these findings that really tells the story. For example, a baby who is floppy all over with weak reflexes might point to one kind of problem, while a baby who's only stiff in the legs with super strong reflexes points to a completely different one. The pattern is everything. So in the end, that's exactly what this is. The infant neurological exam is this incredible, silent conversation that's written in movement. It's a remarkable process where a trained detective can read this intricate story about the nervous system without a single word being spoken. And that really leaves you with a final thought, doesn't it? If every little twitch and posture of a baby can tell such a rich and detailed story, well, what other silent conversations are our own bodies having every single day that maybe we're just not listening to? Something to think about for sure.